Bad over healthcare reimbursements could derail insurance plans for thousands of North Central Florida families.
UF Health and United Healthcare are in negotiations, and they're up against a Sunday deadline. TV 20's Robert Bradfield is here to break down how this could impact patient care.
Well, and as of tonight, there is no deal. 80,000 UF Health patients received this letter in July detailing why they may not be covered after September 1st. I spoke with the UF Health doctor yesterday. You're going to hear from him tonight detailing what exactly is happening from both sides. Families left in limbo as UF Health and United Healthcare work to reach an agreement on reimbursement costs for care to thousands of patients.
And we're going to continue to do everything that we can humanly do to stay in this network.
Dr. Marvin Dewar is CEO UF Health Physicians and is keeping a close eye on the negotiations. He says UF Health hasn't received an increase in payments from United in a decade.
I think everybody listening, understands that the cost of everything is not what it was 10 years ago.
He says UF Health is asking for a fair arrangement, citing an increase in wages and supply cost. Dewar says United's initial request was to make cuts. We asked United for an on-camera interview, but instead we were given price predictions it says are not affordable to families under what it calls UF Health's 25% price hike demand. In a statement, United Healthcare says it remains our top priority to reach an agreement that ensures continued uninterrupted access to UF Health. Some families tell TV 20 they are willing to pay out of pocket for services or use self-pay, but have not been allowed. Dewar says that will happen soon.
We want to make sure that we have a sufficient way to inform them of the choice that they're making, because we don't want people stuck.
Both sides say they are working on granting some patients the opportunity to continue receiving treatment, what's called continuity of care, even if an agreement isn't made. Dewar wants people to know his patients are his priority.
It's about relationships and people who you're getting taken care of, and this is hard for them.
Well, UF Health and United Healthcare say they are willing to meet face-to-face and hash out any differences. There are some UF Health locations that are not impacted by these negotiations, which include UF Health's Psychiatric Hospital and UF Health Central Florida. For other details about what is and what is not covered, look for this story right now on our homepage. That's WCJB.com. Coming up here tonight at 6 o'clock, you will hear from two parents who are taking it upon themselves to find alternative care for their children. Robert Bradfield, TV 20 News.
Up over health insurance has some North Central Florida families turning to TV 20 for help.
Doctors' appointments and even some procedures put on hold as UF Health and United Healthcare negotiate over reimbursement rates. TV 20's Robert Bradfield is here trying to get answers before a weekend deadline. Robert?
Well, both sides say they are negotiating in hopes of reaching that deadline, which is in 4 days, September 1st. This is for commercial health plans. At issue here, UF Health wants to be paid more for services, citing their reimbursement rates from United Healthcare have not changed over the course of a decade because of rising costs. That's what they want. But United Healthcare says those demands are out of reach and unaffordable for families. For Kellen Nanesian, a mother's love knows no bounds.
I would do anything for him.
So when she learned her almost 3-year-old son was diagnosed with a congenital heart defect, she wanted the best doctors. She says she found them at UF Health, but the hospital system's impasse with United Healthcare threatens to take that all away.
They said that we were not going to be allowed to access care there anymore unless they came to an agreement with United Healthcare.
UF Health says 80,000 patients in Gainesville and Jacksonville received this letter in July, explaining they are earnestly negotiating in good faith to provide uninterrupted care for our patients. But if no deal is reached by September 1st, UF Health will no longer be an in-network provider with United Healthcare.
I feel like they were turning their back on my son and my whole family.
Nanesian says her son's upcoming doctor's appointment was postponed, so she looked for another in-network doctor and found one at Arnold Palmer Hospital in Central Florida, a 4-hour round trip.
I could wait a month and then they could call me again and say, we still don't have an agreement with United Healthcare. You know, we have to push it off again, right? And this is a time-sensitive matter.
It's just not in the patient's best interest to have this to be going through this right now.
Ken Gray is looking at other treatment options for his special needs adult son. A team of 12 UF Health doctors care for his son may no longer be in network.
We've reached out to primary care physicians in the area to try to find the new quarterback. Unsuccessfully to this point.
In a statement to TV20, United Healthcare says, "We hope UF Health shares our commitment to renew our relationship and provides a realistic proposal Florida families and employers can afford." Again, the deadline for these two sides is this Sunday, September 1st. United Healthcare says it has a broad network of more than a dozen hospitals that its members will continue to have access to. We do have a list of those on our website, WCJB.com. I also spoke with a UF Health doctor about these impacts. That interview and the full statement from United Healthcare, both right now on the homepage. I will keep you updated. Robert Bradfield, TV20 News.